This webinar will begin in 5 minutes. Hi, everybody. Good afternoon. Welcome to the Scope at Lunch, a special edition of the Scope podcast. My name is Paige Heitman, and I'm your host for today's webinar. We're going to touch on a couple of housekeeping items before we get started, so just bear with me. First, this Zoom session will be recorded. I've already pressed record. We'd like to know who everyone is, so please ensure that your name is accurate. If you need help with this, please reach out to us using the chat box feature. I will be moderating the session with my Phelps Health marketing colleague who's already said hello in the chat. So one of us are going to be sure to help you guys if you need it. Please feel free to reach out. Also, we would love to see everyone's faces. It makes for a much more fun and interactive session. If you feel comfortable doing so, please go ahead and turn on your video. Note that each of you are currently muted. If you have a question that pertains to the topic being discussed, go ahead and add that question to the chat box and we'll try to get it answered. You can also add comments in the chat box. One thing to note about the chat box is that you can send questions and comments to the whole group or just one person. We'd encourage you to send your questions or comments or anything else to the whole group so that everyone can participate in the discussion. However, you are also welcome to send a private question or comment if you feel more comfortable doing so. This session is a time for our Phelps Health panel of experts to share their knowledge and expertise of the COVID-19 situation with each of you. We ask that you be considerate and respectful of the panel members and the community members that have chosen to spend their lunch hour with us for this discussion. We also want to encourage everyone to utilize the reactions that Zoom offers during this discussion today. You can use the hand clap, thumbs up, thumbs down, etc., to let us know if you like, love, agree, disagree with whatever we're discussing. Reactions can be found in two places, one either on the top or one on the bottom of your screen, and one you'll see when you display the participant list. Also, if you're watching from our Facebook live stream, feel free to ask questions, comment, or show us emoticons during our conversation. We will be conducting a few polls throughout this Zoom, so you'll get a chance to interact then if you choose, and of course, remember the chat feature. And all of our polling questions are anonymous as well, so just something to note. Some of you may be using a mobile device while others of you are using a laptop or a computer. If you find that your features are not the same, we just ask that you participate with us however you can. If you have issues with your sound, the Zoom meeting, or other features, please go ahead and use the chat box and one of our moderators will be happy to assist you. Before we dive in with community updates and a polling question, I'll give some quick introductions for each of our panel members, which everybody kind of knows. Ed Clayton is the president and CEO of Phelps Health. Go ahead and wave, Ed. Next, we have Dr. Rochelle Gorell, who's the Division Chief of Primary Care for Phelps Health Medical Group and a family medicine physician. Dr. Gorell, if you wouldn't mind to wave and say hi. Dr. Nathan Ratchford is up next. He's the Senior Vice President and Chief Medical Officer of the hospital, and he also serves the community as a gynecologist. Dr. Ratchford. And last but not least, we have Dr. Brian Creedy, who's an ENT or ear, nose, and throat provider and the Medical Director of Surgical Services at Phelps Health. Dr. Creedy, go ahead and wave, say hi. Perfect. So today, to get us started off, we are going to start with a polling question. So let me go ahead and pop that up for everybody. So the question is, how important do you think it is to wear a mask? I'll give everybody about 20 seconds to go ahead and answer that. Got about 10 seconds left. All right, I'm going to go ahead and close the poll and share those results. So it looks like we're split a couple of different ways. So we have most of people thinking that it's very important to wear a mask, and we have a couple of people who think that, maybe it's not important at all, which leads us into our first question, which is really important. Let me go ahead and stop sharing this. So our first question is, how has Phelps Health continued to care for patients while we've seen a surge in our community? And Ed, I'll go ahead and let you answer that one first.
All right. Well, to a large extent, it's because of the dedication of our staff, employees, and medical staff. We have facilities here that would allow us to care for many more patients than we actually have. Our limiting factor is just the availability of staff, and whether it was early on with the temporary emergency department site across from the emergency room to when that became a screening station, we had staff and we had physicians step up and help take on the responsibility of that additional care for the community. And as things have transitioned over into in our emergency department, and then admissions into our facility. The same thing has happened. We've had our staff have really stepped up and taken on that extra burden. Certainly, we've tried to do things to help support the care they're providing in terms of adjustments to the facility and making sure we're providing appropriate PP&E. But at the end of the day, it's been the staff and the physicians that have stepped up and made sure this community continues to have access to the care that's needed.
Yeah, absolutely. So that, that kind of brings us into our second question. And this one, Dr. Grell, is for you. And it talks about, the surge and this increasing of positivity rates. Why does Phelps County and the surrounding counties we serve continue to see increasing positivity rates?
I believe that's due to multiple reasons. First, you have to remember this virus can be kind of sneaky, and patients can be infectious up to 48 hours before they even show symptoms. So it can be easily spread without someone realizing they are even getting sick. The virus also has a long incubation period up to 14 days. So, people get tired of being quarantined if they've been exposed. And so they may not get symptoms till way after 2 weeks. And patients really have to be diligent about hand washing, social distancing, wearing their mask when they're out in public. And unfortunately, a lot of people haven't done that or done it consistently, so it continues to spread and increase our numbers. The last thing is we're all have COVID fatigue, and we're very social. We want to get out and see our families. We're tired of being locked down. And so people are getting out and seeing people in intimate gatherings and little groups, or bigger groups even, and that just increases the chance of contracting and spreading the COVID virus.
Yeah, absolutely. So I kind of have a follow-up question for you as well, Dr. Gorell. Why is the high positivity rate not a good thing, which is something that we've seen in our communities?
Well, through our Phelps Health system, so all the tests that we check, our current positivity rate is getting close to 30%. So 1 in 3 people tested have a positive result. And so when your community spread is that high, it's really hard to keep the virus from getting to that vulnerable population. That are those patients and family members that are more at risk for serious complications if they get sick with COVID. And so that can lead to the hospitalizations and even the deaths. So that's where, the high community spread is just, really worrisome.
And who are those vulnerable population members that you're talking about?
So those are usually our older population, our patients that have, other illnesses like diabetes, emphysema, chronic lung disease, just, chronic health problems. Maybe they're weaker or frailer, and definitely our nursing home setting is very vulnerable.
Absolutely. So we're going to go ahead and move on to our next question. Dr. Creedy, this one's for you. Because we have such high positivity rates and, we've seen surges within our communities, what can the community do to help slow the spread of COVID-19?
Yeah, so I'm going to sound a little bit like a broken record. We've all heard these 3 things, right? Wear a face cover, wash your hands, and keep a safe distance. So you want to clean your hands as often as you can, either with soap or water for at least 20 seconds, or using something with 60% alcohol in it. Avoid close contact with people that are sick. That one's pretty obvious. You want to put some distance between yourself and other people, at least 6 feet. We're all familiar with the 6-foot rule. Cover your mouth with a nose or mask when around others that you typically don't live with. Cover your cough or sneeze with a tissue, and then throw the tissue in the trash, of course. And clean and disinfect any frequently touched objects and surfaces on a regular basis. And then obviously the CDC also recommends wearing a mask when out in public. And I'd like to add a 4th now, because there is a 4th thing we can do, and vaccination is right around the corner. That may be the most important thing we can do to help the spread of this.
So I kind of want to digress for a minute and then we'll get back on topic. Why is it so important to do all of those things and not just one of them?
So each of those in and of themselves are helpful, but they only help a little bit. They're additive. So doing all of them together leads to a much better response and better control of this all in all, because there's varying degrees of help that these things can do. Obviously, there's a lot of controversy regarding the mask and whether or not it helps, but every little bit can make a big difference, especially with the amount of spread we've been seeing lately.
Absolutely. So moving on to our next question, question 5, Dr. Ratchford, this one's for you. If somebody is experiencing symptoms of COVID-19, instead of going to work, which we all sometimes feel like we have to do for, various reasons, what should they do instead?
Yeah, I mean, clearly if you're afraid that you're sick, you don't want to expose other people, and going to work would be a bad idea. The symptoms of COVID are basically what you'd expect with like a cold. So most people are going to have, fever, runny nose, cough, sore throat. The one everybody always thinks is interesting is loss of taste and smell. So if you think you might have COVID, you definitely don't want to go to work. You don't want to be around other people that you could get sick. Most people are going to have a pretty mild illness and can safely isolate themselves at home, and it's usually just supportive care, and it'll run its course over a number of days. If someone needs more direction, if they're not sure if they should be evaluated, I'd certainly encourage them to call their primary care doctor for further instructions. And barring that, we have the COVID triage area across from the emergency room, and Monday through Friday from 8 to 4:30. If you don't have a primary care provider, you can go through there and be evaluated for COVID.
Great. So we've got lots of options. Before we go into our next polling question, I want to touch on something you said. You mentioned supportive care. What do we mean whenever we say supportive care?
Yeah, for most people, it's going to be staying hydrated, resting, for like just symptoms relief, just taking care of yourself at home like you would with any cold.
Great. Thanks so much. So next, we're going to dive into another polling question, and then we'll get into our next segment. Let me go ahead and pull that up really quick. So this question is, will you get a COVID-19 vaccine when they become available? I'll give everybody about 20 seconds to go ahead and answer this. About 5 more seconds left. And I'm going to go ahead and end the polling and share the results. So it looks like we're split a little bit. We have 67% of people who say yes, absolutely, they would get a COVID-19 vaccine. And then we have the rest of the percentage saying no, or maybe, which some of those people maybe just need more information. So I'm going to go ahead and stop sharing those results, click out of that, and then we're going to go ahead and jump right into vaccine questions. So Ed, do we know when a COVID-19 vaccine is going to be available within our community?
Well, like a lot of things related to COVID, I'm a little hesitant about predicting anything into the future with it. But what is supposed to happen is beginning next week, Phelps Health is able to order vaccines for patient-facing healthcare workers that we anticipate receiving the following week, so the week between Christmas and New Year's, that we'll begin to be able to start vaccinating those individuals that qualify. It's a tricky question because each state has their own rollout plan. The state of Missouri has 3 different phases. There's the first phase, which we're now at the very beginning of. About 3 months in, so think about mid-March or so, there's a second phase where critical infrastructure individuals such as teachers and first responders and folks like that would be eligible for the vaccine. But it'll probably be mid-June if this plan works out before it's just available to the broad community. Again, this is a very dynamic, events that are around this, and that timeline could change one way or the other day to day. So, but that's what we're expecting right now.
Great, thanks, Ed. Yeah, you kind of mentioned it's dynamic. There's so much that we don't know. So talking about things we don't know, question number 7, Dr. Radford or Ed, you kind of touched on this. Who is going to receive the vaccine first, and why do they get the vaccine first? What's the reasoning behind that?
Dr. Ratcher, you want to go?
Yeah, I mean, just like what Ed was talking about, the priority for who receives the vaccine first, that actually comes from the state. And so the patient-facing healthcare workers, they're in that first group, which, like Ed said earlier, that really has been our rate-limiting step for how we can take care of patients here at the facility. Most of the patient care that we provide, even before COVID, isn't so much as determined by available beds and physical space as much as it is the staff that we have that can take care of patients. So we really want to try to immunize and protect that group first, and then it goes from there.
Great. Anything to add to that, Ed?
No, yeah, what I would say is the people that are getting it first are the ones that should and need to get it first. And so, when you look at your panel today, the three people that will be first in line are the three physicians that are taking care of patients. Paige, you and I will be, at the back of the line. I mean, that's just the way it is. That's the way it should be.
Yeah.
Because we need to make sure those frontline healthcare workers are the first ones to get it.
Yeah, absolutely. So moving on to our next question, Dr. Grau, this one's for you. And, we get asked this a lot, even about the flu vaccine. Is the vaccine safe? A lot of people are really scared to, even get it when it's available.
Yes, I know there's been a lot of questions about that just because of how fast the vaccine came out. It's new technology, but it's been something they've been working on for the last several years. And so because of the way it's made, it actually is made much quicker than our typical flu vaccine, those kind of things. So that's why it's come out so fast. But yes, the vaccine is safe. It's gone through the usual rigorous studies and trials to show its effectiveness and safety. These studies included tens of thousands of patients that either got the vaccine or got the placebo, and it's called double-blinded, so neither the patient receiving the injection, one or the other, or the person giving it knew what they were getting. So that makes it a very good study. So I believe it is safe, and I would encourage everyone to get the vaccine.
And I have a follow-up question for that as well. If a person has had COVID-19, do they even need to get the vaccine? Do they have immunity? How long do they have immunity, right?
And there's a lot of questions about that. And they definitely say those that have had the coronavirus or COVID-19 already should go ahead and get the vaccine. Unless you're in the acute phase or you're dealing with it right then, you could probably delay. But other than that, it's recommended to go ahead. Many patients are having very mild cases of COVID and are not necessarily triggering much of an immune response or building enough antibodies. And so they may not be protected in the future, and the vaccine will trigger that response and give us the antibodies that we need.
Great. And this made me think of a follow-up question as well. The vaccine comes in multiple doses, correct?
How do you mean by multiple doses? I mean,
do you have to get like a booster shot?
Okay, yeah. So the Pfizer vaccine, that's the one that's been authorized already. You'll get your first shot, and then 21 days later, you'll get the second. The Moderna is first shot, and then 28 days afterwards. So yes, it's a 2-shot series.
Great, awesome. So we're going to move on to question 10. Dr. Creedy, this one's for you. As well as getting vaccinated, and you kind of mentioned this before, so it's kind of like beating a dead horse, but I think it's worth talking about. Whenever the vaccine becomes readily available, what are other ways that we can protect ourselves from the coronavirus? Because getting the vaccine doesn't mean that you won't get it, right?
So hopefully it protects you. The vaccines that are out now are showing around 90 to 95% efficacy. So what that means is if you get vaccinated, you have like a 1 in 20 chance of catching it still. But I'll take those on. That's actually pretty good. But there's plenty of other things you can do. We talked about the big 3, and now it's going to be the big 4 with vaccines out. But, this has been a tough time for a lot of people. We've been stuck at home, haven't been able to go to the gym. We've been, binge eating, binge watching videos and stuff like that. So there's a lot of other things that can be done. So number one, you want to try to stay active. Even though, a lot of the gyms have been closed and so forth, there's still a lot of things that can be done at home. You can do aerobics. We say avoid large crowds, but that doesn't mean you can't go outside to go for a brisk walk, jog, things like that. Just do your best to stay in shape. Number 2, try to get adequate sleep. The CDC recommends adults age 18 to 60 to get at least 7 hours of sleep per night. That's a big part of keeping your immune system healthy and can help fight this off. Obviously, diet and nutrition are always important. Avoid any emotional eating during this stressful time, and make it a habit to eat more whole, nutritious foods instead of processed foods or fast foods. Self-care, take time for yourself. Be supportive. Suggest the same for those that are living close to you. Spend quality time with your household members, and just take good care of yourself. And last but not least, I think this is the most important, is healthcare maintenance. I've seen a lot of folks that have been hesitant to take care of their blood pressure issues, take care of their blood sugars, because they were scared to come into the physician's office. And I want to assure everyone, it's a safe thing to do that, and just stay on top of your health. Don't let things get carried away.
Let's sidetrack again for a minute. If people are, afraid to come into the office, what options do they have at Phelps Health?
We do have a lot of telemedicine options where we can, in a format just like this, we can talk over the phone and handle many things through this and kind of stay on top of your health-related issues this way.
Great, awesome. I don't know about you guys, but I think this is pretty enjoyable. So it's not a bad option. So we're going to go ahead and go into our next polling question, which is how overwhelmed has the pandemic made you feel since March? Give everybody again about 20 seconds to answer that question. We've got about 5 seconds left. And I'm going to go ahead and share those results. So overall, it looks like everybody, in some capacity maybe has felt at least a little overwhelmed. We've have a couple people who haven't felt overwhelmed at all. I would love to talk with you. Maybe get some insights from you. I'm going to go ahead and stop sharing these, and then we'll move on to our next set of questions. So question 11, this one, Dr. Creedy, we'll start with you. What kind of impact does community spread have on hospital resources like PPE and staffing?
So this is kind of a fun question for me because I remember way back in March, which seems like 5 years ago, this was a big issue. Everyone was fighting for the same resources, masks, gowns, all those sorts of things. And we had several community collaborations to assist with this. I know Missouri S&T in particular I worked with a lot, and we actually were 3D printing PPE and so on and so forth. But when we get to high community spread like we're seeing here in our community now, we burn through a lot of this PPE. If you get admitted to the hospital and you have COVID, anytime anyone goes into your room to see you, they need to put on a gown, a mask, goggles, and that all needs to be taken off after you come out of the room. Now you take that times, 30, 40, 50 patients, you can see how quickly, these resources would be used.
Yeah, that's a lot. So kind of moving on to our next question, I think this correlates really well with it because we've been really overwhelmed. We've been using a lot of hospital resources. Staffing has been kind of crazy. Ed, what has Phelps Health done to promote the overall health and wellness of its employees since COVID-19 began all the way back in March? What Dr. Creedy said, kind of feels like 5 years ago.
Well, we've tried to keep our employees in as safe a position as we possibly can. Our caregivers are doing, they're putting themselves in the line of fire or in danger every day when they're caring for patients. And so we've certainly made the commitment that we're going to try to provide as much PPE as possible. As an organization, we require masking. And have since March. That if you're going to be in one of our facilities, you're going to be masked unless you're in a room by yourself. And again, that's to protect our staff and their health. We've gotten very accustomed to these Zoom meetings. Healthcare is known. We meet to talk about when we're going to meet, and so that's been certainly a change in our culture. To have more meetings that are online, where we're not gathering in person. Even as our holidays approach, many of our areas, our departments typically will get together and have some type of holiday meal, and we've tried to regulate that so that they can still celebrate, but aren't gathering together and creating a risk for each other. So a lot of those things, and then the other thing, our health plan encourages once-a-year wellness visits, and there was some conversation earlier in the year about whether we should do that given the current environment, and we decided that was definitely something we wanted our employees to continue to be seen by their primary care doctors and making sure they're getting their health taken care of and advice from their physicians, and so we continue to encourage that through the way our health plan is designed. So we'd always love to do more. Our employees are our greatest resource, and without them, we can't care for the community. So we're trying to do everything we can. But those are the things we do.
Yeah, I'd say that's quite a lot. I know as an employee, I'm not frontline, but I've been really impressed with what Phelps Health has done. So moving on to our next question, Dr. Ratchford, this one's for you. We kind of just talked about, the upcoming holidays and what we're doing internally, but what are recommendations for just the community in general for traveling and family gatherings and those sorts of things?
Yeah, this one's kind of a bummer, isn't it? So, I struggle with this with my family too. I'm in this with everybody else. Normally with my family, with my kids, my in-laws live in Illinois. My family's down in the Joplin area. We normally divide up the 2 weekends around Christmas and New Year, and we make a big event of it. And we're not doing that this year. So, the recommendation is that your nuclear family, the people that you live with normally, that's really who you should be spending the holidays with. I know that's 180 contrary to what most of us normally do, and that's a hard pill to swallow. And I empathize with that, but truly, the more exposure you have to other people that you don't normally live with, the more gatherings that you're part of, the more opportunity there is for spread of this. So we really encourage people to try to find ways to enjoy the holidays without coming into contact with a lot of other people like what you normally would.
Great recommendations. So, question 14, Dr. Gurrell, many Americans have struggled with their mental health this year from loss of jobs and not being able to attend, regular sporting events or, even holiday parties or gatherings this year to even losing loved ones. What are ways that people can support themselves and their loved ones who are struggling with their mental health right now?
Well, one of the things that I think is technology. We still want to be involved with our families. And so if you can use Zoom, FaceTime, Skype, anything to connect with your loved ones so you can still see them, talk with them, and feel that you're close. And I think that really helps lift spirits that way. Just because you can't physically be with them, if you can at least see them and make that contact. Dr. Creedy mentioned a lot of good health things, keeping up with good nutrition and regular exercise. We definitely know that exercise releases endorphins and other chemicals that help us feel better, feel happier, and more easygoing. So, finding an activity that you enjoy and keeping with it. You may have to just make some modifications to it. If you're used to going to a gym, is there a way that you can do something outside and lift weights elsewhere, or go travel down and hike outside, or different places that have walking paths and stuff. You can still keep your social distance and keep yourself safe. Definitely just getting out of the house. People feel like they just have to be locked up in the house, and if they can get out and enjoy nature, get some sunshine and some fresh air, that it can really do wonders. Lastly, reach out to us as your healthcare providers. We're ready to listen and to help you if you're struggling with your mental health or in any health concerns. As they mentioned, we're still open for business. We just may have some modifications to help you, whether it's telemedicine, or do know that all of our clinics and our sites are doing screening at the door, making sure that patients are wearing their masks just like the employees. And so we're trying to make a very safe environment so that you can come in and still get your healthcare needs taken care of. We're always here to help. And so do call, reach out, contact us in any way you can.
Really great. Thank you so much. So next we're going to roll right into participant questions, and we had quite a few come through. So I'm going to go ahead and start with this one for whoever would like to answer it. How do our numbers compare to March?
Well, I will take a stab at that. I think, in March, we were very fortunate that the major metropolitan areas weren't fortunate, but we were, in that we did not see near the incidents in terms of positivity rate or hospitalizations that was going on back sort of in that first wave in March and April. What we have seen really since mid-August, but has continued through September, October, and November, is every month an increase in our positivity rate. Back in August, that number was probably around 10%. As Dr. Gurrell mentioned, it's up around 30% today. And we really didn't have any hospitalizations in our community until around August. And today, on average, that number crept up over the last few months, and on average, we have about 30 patients on a daily basis that are in our institution with COVID. So the numbers are absolutely ramping up, and that incline was consistent through probably mid to late November. We've seen kind of the same numbers in early December that we saw at the end of November. So that gives you an idea. Really, the big hit for our area has been the second wave.
Would anybody like to add anything to that? I'll give you a second.
I guess we might mention that we have started posting on our social media some of that information. So if patients want to follow along with what's happening at the hospital, it is available.
Great, absolutely. We do post that information, that data on Wednesdays and Fridays at 10 a.m. So anybody who's listening, you're welcome to see that information at that time. And another question that we had that came through are, and
Hey,
Ed, you
can
kind
I
of
make a
allude.
comment real quick?
Yeah, absolutely.
So just to put this in perspective, we all hear what's going on out in California with all these shutdowns and stuff like that. Their positivity rate sitting at like 10 to 11%. We're 2 to 3 times that. So it is quite busy around here right now. So I wanted to make sure we put that in perspective.
Yeah, Dr. Creedy, I'll ask you a follow-up question to this. It didn't come through, but I just thought of it. Why do you think we got hit so bad in the second wave versus the first wave?
I think it has a lot to do with it. Just took time to get to the rural areas. I mean, we're more spread out here, and it took a while for the spread to get here. So it traveled from the larger cities to the suburbs, and eventually made its way out into the more rural areas like ours. And secondly, like I said, because of quarantine fatigue, mask fatigue, all of these things, we were maybe a little less prepared mentally to do what we needed to do to slow the spread of this. And unfortunately, it's spread quite a bit in this area. So like I said, it just took time to reach us. And like I said, unfortunately, it caught us at a bad time.
Mm-hmm. Yeah, kind of like what you said, in the middle of COVID fatigue, right? Kind of bad timing to have such high rates. So one of the next questions that came through were, are things getting worse or better? So I don't know if we'd like to talk a little bit more about how things are getting worse and maybe what we can do as a community to help slow the spread.
Well, I'll follow up and then definitely have some of the physicians on the panel continue on with the answer. But yes, things have been every indicator has been going the wrong direction since early September, and so these rates where we're at now, the positivity rate being around 30% is as high as it's been. The number of patients on average that we have in the hospital with COVID are as high as they've been. Our COVID shed in the month of November had the highest volume that had gone through there than we had seen up to that point. And so yeah, every including and deaths, I will mention that as well. We didn't really experience any patient deaths here in our area until August or early September. That number was 4. We had 4 deaths in September, 9 in October, 20 in November, and right now we're projecting we think we'll have around 30 or 31 in December, the way unless the trending changes. So every indicator, no matter how you're wanting to look at it, is going the wrong way. What we can do to change the trend is the things that Dr. Creedy talked about earlier: the masking, the social distancing, the hand hygiene, and the vaccinations when they're available.
Would anybody like to add to that?
Sure. Like I said, it only takes a walk through our ICU right now to realize kind of what's been going on and how bad this has gotten. It's heartbreaking to see, but it's been a tough time.
Yeah, I think I'll add to that. One of my colleagues over here, they kind of mentioned if it keeps trending like how Ed is talking about, it's almost a death a day, and I think that's really disheartening. So hopefully that encourages the community and all of us to continue to do all of these things to change the tides. So another question that we had that came through, and this is a little technical, was would it be possible to do a percentage of admissions due to COVID-19? The floors are at near capacity. Is it due to 90% of patients being COVID patients, or is it 10% of patients being COVID positive with just a lot of sick people? So I guess the question that they're asking is, do we have a lot of COVID patients or do we just have a lot of sick people in the hospital right now?
The answer is yes to both.
Mhm.
Yeah, again, we really didn't have hospitalizations until August. Our current rate of patients in the hospital that are COVID positives are around 30%. So, and that number has crept up. It was in the single digits in September, about 12 or 13% in October, about 25% in November. So now we're up around 30%. So, and they're sick patients. The COVID symptoms span the gamut, but the patients that end up in our hospital are really sick with COVID. So it's both the numbers and the acuity of our patients.
Great, thanks, Ed. So I had one more question that I had thought of whenever we were talking before the scope began. What have you all learned from this experience so far? Dr. Grell, I'd like to kind of toss that to you because you and I think it was Dr. Creedy were talking about this before the scope started. And I think that maybe is something positive that has come from this experience so far.
Yeah, we had mentioned that, especially that first few weeks as we were, locking down, trying to figure out, how would we proceed forward if this hit our community. And, at that time, it was way early, but I have way more phone numbers than I ever did. I have met more of the staff and worked with people that I wouldn't have prior. Early on when we were in the lockdown, we didn't have surgeries going on. A lot of the surgery team was out at the COVID shed where I helped manage and even saw patients. And I've gotten to meet so many of them, and then, just, speaking around the community and different things. So a positive is, getting to know a lot more of the Phelps Health employees, and even learning. I know a lot of employees have even learned some other jobs that they didn't do before. Just like that, they were in surgery, but they went out and they learned how to do nasal swabs and, work with physicians in a different manner. So that's been a good positive at least for our health system and things. So.
Yeah, I would agree with that as well. I've met a lot of new people just in the hospital, and probably even more importantly in the community, a lot of community leaders that I've never spoken to before, and I've made some really, really great connections and some really great friends. But most of all, what I think I've realized is the quality of the people we work with here at the hospital is, it's unprecedented. I couldn't be more proud of how they've worked through this and continue to work through this. And I feel like I work at the greatest place there is.
Mm-hmm.
Like
I second
Disneyland.
that. Yeah.
That's awesome. Dr. Radford, Ed, is there anything you'd like to add to that? Any positives that maybe you've learned since March? I know we've kind of been down in the depths since March, but I think that's kind of cool.
Yeah, just to kind of build off of what Dr. Creedy and Dr. Gorell were saying, working with the teams that have been tackling these problems that we've never faced before has been a challenge, and I feel like we've rose to the occasion. So I really just kind of learning what we can do and how it can come together. That's been the silver lining of this whole thing.
And I'll add to that too. Generally speaking, healthcare organizations like ours are kind of slow-moving, meticulous about changes and things like that. And this has required us to make quick decisions, create our situations quickly where we can care for patients in the right way. And I've been very proud of the way the organization has reacted quickly to the changing environment and has been able to provide the best care for our community that's been possible. So I think that's not that I didn't think that was the case, but we've never had the opportunity to demonstrate it quite like we have over the last 9 months. So that's been something great to see from the folks I work with.
And kind of to add, as Dr. Creedy mentioned, especially at the beginning, the community just reached out to us like, oh my, it was amazing to see MS&T making the 3D printed objects, We had a company that usually does boat covers make isolation gowns. I mean, everybody was so innovative in how they could make things for us and help us out. So we appreciate all the community, all the way down to those people bringing things for us when we were down or busy or making masks. Everybody has been just amazing.
Yeah, I remember back in March, we would have people show up at the front of the hospital with a trunk load of masks and gloves that they had from their business, and they knew we needed them, and just really coming together. It was nice to see.
Yeah, that's awesome. I think that's a great way to end the show, a little bit of holiday joy, if you will. So with that, I'd like to go ahead and say thank you so much to everyone for tuning into The Scope. A huge thank you to each of our panel members for joining us today. As we've kind of heard, we're a lot busier now in a different capacity than maybe we were in March. So we really appreciate you guys being with us and sharing your insight with our community today. As a reminder, this show has been recorded and will be emailed to all participants. It can also be rewatched on our Facebook page and shared with family and friends who may have missed the show. If you like this show and would like to know more, go ahead and check out our other episodes of The Scope on YouTube or visit phelpshealth.org. Have a great rest of your day and happy holiday season, everyone. Thanks so much.
Merry Christmas.
Merry Christmas.